Today we're going to be examining the asbestos disaster that took place in Libby, Montana. First, we will examine some background information about the mine and about what happened. Then we will dive into environmental and health implications as well as long-term effects, and we will sum it all up at the end. The main purpose of this presentation is to understand the asbestos disaster that took place, as well as understand health implications that resulted from it. We will also be analyzing existing research and examining long-term implications and resolutions. Here you can see an aerial photo of Libby's now closed W.R. Grayson Cove vermiculite mine. Vermiculite is a mineral which is often used for construction purposes, specifically insulation. It's also used for potting soil and fertilizer. And when W.R. Grayson Company took over the operation of the mines back in 1963, they knew the vermiculite was contaminated with asbestos and that it caused health complications. However, they did not warn anybody, so mining continued. The Libby mine contained a type of naturally occurring asbestos called tremolite actinolite. In the next few slides, we are going to be examining data from a cohort study that consisted of 406 men employed in the Libby, Montana mines before 1963 for at least 1 year, and they were followed up until July of 1983. This table helps us to better understand the condition in the mines and the miners' exposure to asbestos particles. As you can see, the concentration of fibers varies significantly depending on the location at which the miners are working. In the mine pit, we observe a noticeable difference between the working and drilling area, which obviously seems to make sense since drilling tends to release fine particles into the air. The dry mill appears to have the highest level of fiber concentrations in the air at 101.5 and 124.9 fibers per milliliter, while the second highest is seen in the skip boot area. The lowest is actually observed during testing, which takes place in a van, and that comes in at 1.0 fibers per milliliter. In this graph, we are looking at the average years worked in the mine and the cumulative fiber exposures per year. As you can see, it appears that those with the highest level of cumulative exposure, greater than or equal to 500 fibers per milliliter per year, also appear to have worked the longest in the mines, averaging at about 16 years. Those with the lowest cumulative exposure of less than 25 fibers per milliliter per year appear to have worked the shortest length of time, on average about 3 years. And this is important to keep in mind as a higher concentration of asbestos fibers over a longer period of time has been shown in research to be related to the likelihood of developing an asbestos-related condition. As you can see in the diagram, in this sample of men, most men, or equivalent to 33%, died from heart disease related to asbestos exposures in the mines in Libby, Montana. The next largest cause of death came from malignant neoplasms. 13% came from other respiratory conditions, and it's important to pay attention to the respiratory conditions as well as the malignant neoplasms, as asbestos primarily attacks the lungs. And one of the most commonly known asbestos-related diseases, mesothelioma, is included in the malignant neoplasm group. In this diagram, we observe that among all reported malignant neoplasm deaths, the most common cases were located in the trachea, bronchus, and lungs. It's important to remember that this is just a sample of workers from the mine in Libby, Montana. It's important to consider what may have been many more unreported cases. It's important to remember that vermiculite was used in a variety of construction materials, including insulations for homes and buildings, which is why a lot of times older homes find asbestos and they need to have that removed. It's also important to note that the W.R. Grayson Company continued mining operations despite knowing they had asbestos contamination, which put hundreds of lives at risk. And about 400 Libby residents actually died, and over 3,000 are still living with asbestos-related diseases currently. And miners' families also came down with asbestos-related illnesses. as a result of them bringing fibers home on their clothes, on their shoes, and even in their hair and on their skin. And the mine closed finally in 1990, and the EPA began investigating and began cleanup efforts in 1999.